So let's talk about the Pfizer-BioNTech basics. So the Pfizer vaccine was approved under emergency use authorization in mid-December. It is an mRNA vaccine. It's given in a 2-dose series, 3 weeks apart. This has actually already started rolling out across the U.S. in smaller batches. So this is approved for anyone ages 16 and up. The only contraindication that exists is a severe allergic reaction to any component of the vaccine. There are about 6 components to the vaccine, so that makes it pretty straightforward to determine if somebody is truly contraindicated. This schematic from the CDC shows who can go ahead and receive the vaccine without any caution, who we need to have a little bit more precaution for, and who is contraindicated. Again, anybody with a history of allergic reaction to any component of the vaccine is contraindicated. Over in the green side, you may proceed with vaccine if somebody has immunocompromising conditions. It's actually been studied in stable HIV patients. Pregnancy, lactation, it has not been studied specifically in those settings, but it is believed to be safe. Furthermore, if you have allergies, even if they are an anaphylactic reaction to something, you can go ahead and receive the vaccine unless that allergy has been to another immunization or an injectable medication. And we'll talk a little bit more about that. If somebody has a history of anaphylactic reaction and they carry an EpiPen for that, then the recommendation is that they receive observation for 30 minutes after immunization instead of their typical 15-minute observation period. But they can go ahead and receive that vaccine without any concern. If somebody has had a reaction to another vaccine or to an injectable medication, then they recommend proceeding with caution and having risk assessment from your provider and having the vaccine administered in a more controlled environment. Side effects, just like any vaccine that we give, there are potential side effects, and these are pretty typical vaccine side effects. Sight, pain, swelling, redness, tiredness, headache, muscle pain, chills, joint pain, fevers, nausea, swollen lymph nodes. Those type of reactions that we expect because your immune system is working to create that immune response. This is not the COVID-19 infection, it is your body developing that immune response. However, you are developing immunity over time, so that doesn't preclude you from developing COVID-19. If somebody were to develop specific signs and symptoms of COVID-19, such as the loss of taste, the cough, shortness of breath, those are concerning for the virus and not related to the vaccine administration. The good news is the CDC has already developed clear guidance for occupational health on how to determine if somebody is safe to come into work with some vaccine reaction, that they feel well enough to work, or if we need to be concerned that they might have COVID-19 and they need to be excluded and tested. Another good thing that we know is that the vaccine will not cause us to test positive on our viral tests. This is really important for those of us that are receiving frequent viral testing based on the setting that we might be working in. So both the PCR and antigen tests will continue to give an accurate representation of current infection. So if somebody who has received the vaccine tests positive, that means that we need to be concerned that they have an infection, not that it's the vaccine causing that positive result. We don't know, it may actually affect antibody tests, but again, this is just an emerging science, and so we're not too concerned because that is not really driving our clinical decisions at this point.